I'm Marissa Martinez, and my project was on HCA Healthcare. HCA Healthcare is one of the largest healthcare networks in the United States and the UK. They've got 185 hospitals and 119 freestanding surgery centers across 21 states and, like I said, in the United Kingdom. They were founded in 1968 by Dr. Thomas Frist Sr., Dr. Thomas Frist Jr., and Jack Massey. They really changed the way for-profit healthcare in the United States was operated. In the time that HCA Healthcare opened in the 60s, most healthcare organizations were run by government entities and religious organizations. So HCA Healthcare being run by neither of those really changed the way that both nonprofit and for-profit healthcare was looked at in the United States as well as the UK. They have high innovation rates and lots of free cash flow because, like I said, they are one of the largest in the country. Just to give you a little example of their innovation, they were the first to create a foam baby wristband. When the baby is born, instead of putting that paper wristband with the sex, the time of birth, all of that information, it's a foam wristband that doesn't hurt the baby and actually goes on their ankle. And it has a barcode that matches to the mother's barcode on her wristband, so it actually reduced the rates of babies getting switched and displaced from their mothers. One of the negatives to HCA Healthcare was, although they are one of the most ethical companies now in the United States, they do have fraud allegations in the past. Really long story short, what happened was they were upcoding Medicare costs, so they were basically saying that customers or patients had worse ailments or illnesses than they actually did to get more Medicaid. In turn, they had about $1 billion in reserves that went to profits that weren't going to the government. So in 1997, the FBI launched a full investigation, not only about the Medicare upcoding, but also with unethical practices and giving really unfair investments and really unfair enhancements to doctors who referred their patients to HCA, like bonuses, crazy vacations, things like that. So the long story short of that is they had to pay $631 million after it was all said and done to the federal government. So now I'm going to talk about some of the external things that affect HCA Healthcare. One of these would be economic factors. Economic factors impact any company and every person in the country. What I'm going to discuss is the impact of health insurance. Health insurance is mostly the public sector is, changing, kind of unreliable, especially between presidential elections. It changes. Like I said, the president is trying to reduce the involvement of the Affordable Care Act. They want to get the government to be as hands-off as possible. So this is in turn making healthcare laws and insurance policies change in the public sector. The reason this impacts HCA is it impacts both patients and employees. It impacts them because they need to stay on top of knowing what the healthcare laws are, knowing what the insurance policies are. They need to know if a patient who's in long-term care can no longer be in long-term care because their Medicare has been cut off or their Medicaid's been cut off or something's changed in the policies. And in turn, patients also must be very aware of what's going on with their policies because they could be really sick and not be able to get care. Not because of HCA, but because of just the way the cookie crumbles, the way the world works. They need to be very educated with the healthcare system. Coverage is forever changing, but the future could be bright. It is a little bumpy. HCA does need to stay on top of it. It is something that could affect their bottom line and their profit margin, but there's really not too much they can do other than educate their patients and educate their staff. The next external factor I want to talk about is social culture, which is customs, lifestyles, and values. This impacts the community and employees of HCA Healthcare. One factor with HCA is they like to stay in large cities. They don't really branch out to rural areas. So those are possibly smaller communities that aren't getting HCA services. They're not getting any healthcare facilities from any HCA hospitals. This can impact HCA's bottom line as well. I mean, they're not hurting for money at all, but they are missing out on some smaller rural communities. Another issue with these cultural impacts is there are some people who there's going to be bilingual people, there's going to be other communities that aren't as open to healthcare. They want more organic medicine, more natural medicine. Some people refuse to go to the hospital, so that is something that HCA is going to have to keep in mind. HCA is going to need to create some sort of educational program, some way to reach out to these smaller communities that aren't receiving these services. I'm not saying that these communities aren't receiving services at all, but HCA is one of the top rated, programs in the country, and if they could even implement smaller facilities in these rural areas and reach out to those customers who might have issues going to hospitals and dealing with doctors, I think that could greatly improve HCA's community outreach and overall their profits. And the last thing I'm going to talk about is the internal environment. The internal environment affects everyone within HCA, so all of the stakeholders are going to be employees, both upper level and lower level, and in turn that will trickle down to patients, because patients are the greatest seers of all. The first thing I want to talk about is HCA's corporate culture. This does impact the employees, both upper and lower, and the atmosphere. A lot of the research I was doing showed that through Indeed reviews, Glassdoor reviews, employee reviews that were left online after an employee has left, where a lot of employees were disgruntled. They felt that they were overworked. They felt that management was not helpful. They felt that the corporate culture was extremely rigid, and they felt that there weren't any proper controls in place to keep employees happy and therefore keep patients happy. Corporate culture is instilled from the top down, so if the corporate culture at the top is so focused on money making and so focused on the upper level CEOs and executives, and it's not taking care of their nurses, their techs, their staff, all of those people at the bottom, ultimately their corporate culture will never change. And the patients are going to be the ones who see the disgruntled employees, especially if managers aren't listening. So a way that this can be fixed is to instill and have a corporate culture instilled in all HCA hospitals across the country and in the UK that could possibly change the way employees feel about the internal programs and the internal structures within the hospital. Lastly, I'm going to talk about human resources. Human resources is also kind of ties into the corporate culture. They are a key function. They help during changing and fast-paced times within any new corporate culture, and they are there to keep internal controls in place. They are there to hire people who fit within the company, and so the stakeholders would be, like upper level and lower level employees, and the stakeholders and the competing demands are basically the same. Upper level and lower level employees. The way that they can look at this and to fix this is to actually hire someone with good organizational fit. So someone who's going to come in, fit with the hopefully changed corporate culture, someone who is going to fit with the other employees, with the other staff. This is going to streamline all of the operations. This is going to make internal controls hopefully more in place so unethical practices stop, so employees are not disgruntled and not overworked. It all kind of starts with the corporate culture and the human resources aspect of any business. And if HCA Healthcare can actually listen to these employee reviews, listen to what their staff is saying, I think that they could really turn their corporate culture around and their internal environment around, and therefore make employees and staff and patients overall more happy. Thank you.